Before auscultating the heart, let's review normal heart sounds. Closure of the heart valves creates a pair of audible heart sounds. The first sound, S1, accompanies mitral valve closure. The second sound, S2, accompanies aortic valve closure. Pulmonic and tricuspid valve closure may contribute to these sounds. Ventricular systole occurs between S1 and S2. Ventricular diastole occurs between S2 and the next S1. Because diastole usually lasts longer than systole, you can identify the two sounds. 1-2, 1-2, 1-2. You can hear S1 and S2 in the aortic area, in the right second interspace close to the sternum, pulmonic area in the left second interspace close to the sternum, left third interspace, tricuspid area in the left fourth and fifth interspaces, and mitral area at the apical impulse. The aortic and pulmonic areas together are sometimes called the base of the heart.